I hope everyone continues to see encouraging signs of emergence from the pandemic and the recovery of your business. In the meantime, I have some interesting updates to share, so let's get right to this week's IHRSA Take 5, sponsored by Precor. I'm delighted to tell you that IHRSA is holding a collaborative event with the WHO on June the 3rd. This WHO event is called the ReINVENT and ReBUILD webinar, Ready for Change, the future of sport, exercise, and fitness. But this will really be far from the typical webinar. This event includes a high-level panel that wants to hear from all of you to help inform the WHO policy brief on physical activity, which will include our sector for the very first time, which is great news for us and our industry that the WHO is wanting to feature the health and fitness part of this sector. Dr. Michelle Seeger, who is part of IHRSA's Medical Science and Health Advisory Council, and I will be joined by others as part of the discussion. And this policy brief is going to inform governments and policymakers worldwide and help elevate our industry to gain more recognition and credibility into the future. So we're including a link to register in the description of this video, and it is a free event, so I encourage you to actively participate and spread the message to all of your contacts in the industry. Our Global Health and Fitness Alliance members and volunteers are working on some pretty big initiatives, and I have some news that I'd like to share around that. First, the NHFA has opened up membership and is inviting C-suite level people to apply if you're interested. So if you are a thought leader and you have a passion to grow the global industry, find the link to join the NHFA in the description of this video. The second thing I want to share is that the NHFA is working on an exciting, actually the first ever of its kind, global impact economic research study. So a big thanks to our club operators and industry leaders for designing and funding this study. The NHFA Economic Impact Research Project will quantify and amplify how the health and fitness industry contributes to the global economy, as well as the health of the respective communities all around the world. We'll share more information in the coming months, and our next full NHFA meeting will be held on June the 10th. Again, if you'd like to support this innovative initiative or get involved, please visit the link in the description of this video. You may have noticed the IHRSA Advocate Twitter and Facebook platforms have had a new look and direction recently. Don't worry, we're still going to share all the fitness-related advocacy and lobbying content that you're used to seeing, but now it'll be delivered under the National Health and Fitness Alliance branding. The NHFA is a broad-based, open platform, community-driven alliance, bringing together leaders and change makers from a variety of fields and disciplines to do something important for the promotion of health and fitness. We welcome and invite all health and fitness industry stakeholders to connect to the NHFA community. There is no membership. It's just about your participation and your contribution, both of time and perhaps also of funding, if you'd like to do that. And with the new IHRSA dues structure, every U.S. member has the opportunity to get involved with the Alliance automatically, because a portion of all U.S. member dues contribute to our efforts of promoting and protecting the industry as part of the NHFA initiative. A recent article by Dr. David Katz, founder and CEO of Diet ID, and also a member of IHRSA's Medical Science and Health Advisory Council, discusses the new CDC guidelines and the idea that life inherently involves risk. He explains that the new policy validates immunization, rewards vaccination, and that the right time to lift mask mandates is when everyone wanting to be vaccinated has had the chance to do so, or when the risk of infection is lower, which may or may not be right now, depending on where you are in the world and where the vaccine rollout is happening right now. The bottom line here is simply this, according to Dr. Katz. The risk of getting COVID, if you are immunized and even nominally responsible in your behaviors, is very low, with or without mask. Also, the risk of getting severe COVID is all but vanishingly improbable. However, he says, life comes with risk. Dr. Katz also explained that, as with all other vaccines, those inclined to be vaccinated did and are continuing about their normal lives. COVID infection after a vaccine is a low risk, but it's not zero. And COVID infection without a vaccine is a much higher risk, but it's not a certainty either. As we did before the pandemic, Dr. Katz says, we will need to reconcile ourselves again to the idea that living involves risk. After last week, several of you contacted us and asked for more information on the wellness report from Credit Suisse. So I wanted to share a little more information from that report. So Credit Suisse looked into long-term trends that supported wellness growth. One of their findings was that the World Health Organization predicts that the over 60 population will almost double by the year 2050, which could put a premium on health and wellness and also influence purchasing habits. Further, if trends continue, consumers will also see a high cost and countries could see rising death tolls. In response, Credit Suisse predicts consumers and governments will become increasingly aware and involved and incorporate aspects of health and wellness that they hope will help reverse the effects of unhealthy lifestyles. Credit Suisse also predicts people will pursue proactive lifestyle choices that tilt toward health and fitness, such as more exercise, shopping for healthier foods, using health and fitness related apps, and spending more time actively outdoors. They're also seeing younger generations spending more on health and wellness products. That's it for this week. I hope this information helps you feel even more optimistic about the future of our health and wellness industry.